The breast service provides surgical care for women with breast disease. They see 40 to 60 new referrals a week and 12 new patients a month with breast cancer. Dr. Vargas, Chief of Surgical Oncology at Harbor, is seeing Mrs. L, who was referred because of a suspicious mammogram.
So the first thoughts that go through my mind as I walk into a room and I have a patient like Sarah Lynn waiting is she's coming because she perceives she has a problem. And our goal is to help her with that problem.
When I first got the phone call, it was either Melissa or Katie called me and told me that there was something wrong with my mammogram. And I thought, well, you have the wrong number, not me.
So Sarah Lynn, we're gonna go ahead and proceed with the biopsy like we discussed before.
Right.
You'll just feel a little poke of the needle, and then it may or may not sting a little bit. Other than that, I don't expect you to feel anything else at all.
After the biopsy, the team looks at it during the weekly review session with pathology. It definitely shows cancer. At the counseling session, Melissa, the nurse practitioner, goes over things with Mrs. L.
So, Sarah Lynn, I'm glad you're here today, and what we're going to do is really discuss what your diagnosis is. You're a candidate for maybe breast conservation surgery, and we would take a look at some of the lymph nodes you have under your arm versus having your breast removed.
I'm not so much concerned about losing my breast as I am about the cancer coming back.
Right.
I would rather lose my breast than ever have to think that the cancer is going to come back.
Mrs. L talks about other phases of her treatment.
Yeah, the chemotherapy was, it was hard, and I was sick a little bit for about the first week, and yeah, I was very depressed. Radiation was just tiring because it was every day but Saturday and Sunday for 6 weeks.
So how did you feel when you were all finished?
I was very happy. I knew my hair was going to grow back. It was over.
More than 40 million Americans lack health insurance. The United States stands alone amongst developed countries in failing to guarantee its citizens that basic social right. Poverty and immigration deepen this wound, and our city relies on safety net hospitals like Harbor to catch those that fall through the ever-widening cracks in our fragmented healthcare delivery system. These hospitals represent our commitment to care for the most vulnerable amongst us, a safe harbor, if you will, from the storms that might blow through any of our lives. When failures occur, as they do in all hospitals, their public funding draws controversy, and that controversy puts the morale and reputation of the institution at risk. The stories and photos here provide a counterpoint to that all too familiar narrative. These are the faces and the voices of the patients who needed Harbor, and Harbor delivered. These are the faces and the voices of the staff who embody the commitment that underlies Harbor's mission. Future policymakers may fill the cracks in our healthcare system or maybe even discard it as broken and start anew. But until that time, Harbor and hospitals like it are absolutely essential.